MedMaster, your ideal mobile solution for improving patient-centered care and outcomes while reducing healthcare costs. In healthcare today, the focus must be solely on patient-centered care and the necessary documentation, and not on the encounter itself. MedMaster on the iPad augments the care while even enhancing the personal nature of the care. Dr. Sandra Clark is in a doctor-patient encounter with Rob Kennedy. As she examines Rob, Dr. Clark uses MedMaster on her iPad to capture her patient's unique clinical story using speech recognition and clinical language understanding powered by Nuance Healthcare. Dr. Clark explains to Rob that during the exam, she'll also be dictating into her iPad, and that if he hears any inaccuracies, to please stop her so they can discuss or correct it. Dr. Clark begins by dictating the patient's chief complaint, history of present illness, and review of systems. She concludes with her assessment and plan for Rob Kennedy. The next day, Dr. Clark is taking a break from making her rounds in a hospital when a nurse sends her a text message on her iPad to let her know that Rob Kennedy is having difficulty breathing, has gained 2 pounds since yesterday, and is more comfortable sitting up. She also informs Dr. Clark that she started Rob with oxygen at 2 liters per nasal cannula. Dr. Clark accesses Mr. Kennedy's problem list in MedMaster on her iPad. She then navigates to his medication list and his last labs. Dr. Clark orders a chest PA and lateral stat. Reason: worsening heart failure. She also orders Lasix 20 milligrams IV stat. Now, using clinical language understanding powered by Nuance Healthcare, she reprocesses his patient record. CLU flags the 2 new orders as updates. In healthcare today, the focus must be solely on patient-centered care and the necessary documentation, and not on the technology or the lack thereof used during an encounter. MedMaster on the iPad augments the care instead of detracting from the personal nature of the care by the use of non-personal legacy EMR software and a conventional computer of any type. Dr. Kevin West is in a doctor-patient encounter with Nancy Hudson. Dr. West is staring at the screen of a computer workstation found in most medical exam rooms and typing while consulting with Nancy. The computer type system used by Dr. West was a great tool for its time, but healthcare needs to add back the personal touch, which lends to patient-centered care. We now witness another patient encounter, this time with patient Rob Kennedy and Dr. Sandra Clark. MedMaster with voice recognition powered by Nuance Healthcare is used to document Rob's unique clinical story on her iPad. After logging in, Dr. Clark navigates to the Patient tab and then selects Rob Kennedy. She asks what brings him in today, and Rob responds that he's feeling pretty tired lately. After taking only a brief moment to scan his record, she quickly resumes eye contact. She informs Rob that the 2 milligrams tamsulosin that he's taking can cause fatigue, and she suggests he takes it before bedtime instead of in the morning, as it will still have the desired result and may even help him sleep better. With MedMaster, Dr. Clark has immediate access to pertinent, current patient information before commencing the encounter, unlike the non-personal encounter with Dr. West and the legacy EMR software. By not wasting time with countless mouse clicks and scrolling through numerous screens, Dr. Clark was able to swiftly assess why patient Kennedy is in her office that day and to identify an appropriate treatment plan. Truly patient-centered care. In healthcare today, the focus must be solely on patient-centered care at any time and from anywhere. While on call, Dr. Chris Bennett is enjoying a late lunch when he receives a text message from his nurse about Dale Grover, a patient that he has discharged from the emergency department earlier that day. Her text informs him that patient Grover is complaining of dizziness and some slight muscle cramping. Dr. Bennett reaches for his iPad, opens MedMaster, and then uses speech recognition powered by Nuance Healthcare to navigate with ease to the latest info from the EHR to which MedMaster is connected. While Dr. Bennett takes only a brief moment to scan the patient's record within MedMaster, he receives another text message adding that the muscle cramping is new and persistent. Dr. Bennett immediately replies, advising his nurse to have the patient come in and to schedule blood electrolyte, glucose, uric acid level, and kidney function tests for him. Dr. Bennett was able to swiftly assess his patient's problems and to initiate an appropriate treatment plan, truly patient-centered care, at any time and from anywhere. Is it time for you to embrace MedMaster's new generation of healthcare delivery? Download our fully functional demo of MedMaster Mobility and MedMaster Cloud-based EHR from the Apple App Store. Search for MedMaster Mobility and MedMaster EHR in the App Store. And remember, MedMaster is certified for meaningful use. Thank you for joining me, and I know you'll find MedMaster to be your ideal mobile solution for improving patient-centered care and outcomes while reducing healthcare costs.